Radiologic technologists and technicians take X-rays and administer non-radioactive materials into patients' bloodstreams for diagnostic purposes. Some specialize in diagnostic imaging technologies such as computerized tomography and magnetic resonance imaging.
A radiologist's career typically begins with a bachelor's degree followed by medical school. After the classroom work in medical school, one must complete 2 years of clinical rotations in different areas of medicine. In addition to medical school, radiologists must complete 4 years of radiology residency that includes on-the-job training as well as specialty medical education.
Specialty radiology requires a 1 to 2 year fellowship. As new technology increases, more training is required within the field so that it can be used effectively and safely. A radiologist must be licensed to practice medicine and can be earned by passing the United States Medical Licensing Exam or the Comprehensive Osteopathic Medical Licensing Exam. Radiologists also must abide to state requirements. They can have optional certification from the American Board of Radiology or the American Osteopathic Board of Radiology. The entry-level salary for a radiologist is $282,146. After a 10-year period, a radiologist's salary is averaged at $345,000. Radiologists are paid the highest in Massachusetts, Washington, D.C., and New York.
19.1% of radiologists are in multi-specialty practices, 7.3% are in solo practices, and 7.1% work in hospital settings. The turnover rate is 5% as of 2010, according to the Radiology Compensation Survey in 2014. The satisfaction rate of radiologists is 68%, which is higher than most physician specialties. Only 13% of radiologists are females. This does not necessarily turn me away from the occupation. It does, however, make me wonder why there are so few females in the field. But the fact that there are more males than females does not scare me off from the occupation. It makes me want to do it more and show people that I can.
There seems to be a trend that demonstrates an increase in demand, but not as high compared to primary physicians. From the years 2014 to 2015, there was about a 9% increase within the field. Because radiologists are working with radiation, there's an increased risk for cancers due to the interaction with radiation, resulting in about 17 and 28 cancer deaths among the 19,000 radiologists at risk, or an excess cancer risk of between 0.53% and 0.87%. Radiologists have patient contact during procedures such as ultrasounds, MRIs, X-rays, biopsies, and radiation therapies. Afterwards, the patient returns to the care of the primary physician or specialist.
Other careers related to radiology include medical and clinical laboratory technologists and technicians. Medical laboratory technicians and technologists collect and perform tests to analyze body fluids, tissues, and other substances. The first year in a career of radiology is known as starting from scratch for radiologists, but by the next year or two, they get it down and start gaining confidence. Radiologists find an area or specialty they love and want to be a part of and stay educated in the medical side of it, along with understanding new and developing technology. By the 5th year, they are confident and love their jobs and their lifestyles outside of their career too.
Within a 10-year timeline, radiologists can be promoted into department managers or directors as well as chief of technicians. Radiologists may also decide to specialize and do fellowships during their career.
Successful radiologists tend to be determined, organized, focused, and have a passion to learn and maintain scientific interest. They should enjoy computers and technology as it is becoming more and more advanced. How does my work style fit the careers we've discussed? As someone who's extremely passionate, I think my work style would fit well into a career in radiology. I'm a pretty organized person, and although I don't know much about computers, I'm always ready to learn new things.
Radiology is a great field to enter as it is constantly advancing and will continue to be in high demand. The work environment, though has small risk, is not extremely demanding and is good for those who want short amount of patient interaction. The careers existing that are similar to radiology may have more patient care involvement or less schooling. There are many opportunities for radiologists to enhance their careers, such as specialization, certifications, and promotion. Radiologists are vital to the diagnostic process. In what ways do you think radiology impacts the medical fields the greatest?
I'm David, and I'm a pediatric radiologist. So a radiologist is a physician that uses medical imaging to look inside the body and to help other doctors figure out what's wrong. So we get a request from a from a doctor to help figure out a problem, and we put all the images together in our head, we think about what it could be, we see the patient if we need to, and then we send the answer back. It looks like the disease activity has decreased. Everything's looking much better. Unlike a lot of fields of medicine where people are very specialized in dealing with one thing, radiologists tend to deal with a huge variety of issues and cases. So we still are sort of a generalist. To be a radiologist, it takes a long time. Like any other physician, you have to do at least 4 years of college, at least 4 years of medical school, and then 5 years of dedicated radiology training. Because radiology is changing so much, especially because of technology, you have to really be learning all the time. You have to be teaching yourself all the time. And that's probably one of the things that a lot of radiologists really enjoy.
I love seeing radiology is because I think it combines all the best things about medicine. It's like pure, condensed diagnosis. And I kind of came to it in a roundabout kind of way, in that I did obstetrics before, and I did some scanning, and I thought, wow, I wish I could do this